I'll take a closer look at this latest surge and the contributing factors. Joining us now is Dr. Edsel Salvaña, infectious disease specialist. Dr. Edsel, thank you so much for joining us. 4,578 cases. Numbers we haven't seen since September of 2020. Is this a major concern?
Well, any kind of surge is always a major concern, but we also have to think about it in the context of, we're seeing these variants. The proportion of variants still remain low, but, that there is a lag in the time that it takes us to sequence these. So while some of those are probably from the variants, some of those are still going to be just the same old virus. And maybe what's going on is, we're having these transmissions because viruses spread. And as we open up even further, there are more opportunities for the virus to spread.
Edsel, what is the solution to be able to curb this rise? Will it mean granular lockdowns? Will the curfew being imposed by the MMDA from 10 p.m. to 5 a.m. be helpful? Or do we have to get back to where we were a year ago, an enhanced community quarantine?
Well, I think we've learned a lot in the last year. We are better positioned to take care of patients. We have medications that actually work. And we know what works: the face shield, the mask, the physical distancing, and strict quarantine and isolation. And so I think even now we need to even increase our level of adherence to these measures now that we're seeing that the cases are going up.
And right now, we already have more than 1 million vaccines in the country, 2 brands. You have Sinovac and AstraZeneca. When do you think are we likely to see some kind of herd immunity? Because Senator Panfilo Lacson said if we continue with the space of vaccinating our kababayans, it will take 11 years.
Well, herd immunity is aspirational. The vaccines that we have right now are vaccines that are very good at preventing severe disease. And that's okay. I mean, some of them may end up being transmission-blocking vaccines, but that's not the main objective of these first generation of vaccines. It's really to decrease the risk of severe disease. And if you can vaccinate the people who are at highest risk for dying, that includes the healthcare workers as well as the senior citizens, then you can drastically decrease the death rate from COVID-19 and pretty much transform it into something like the common cold. So even if you vaccinate the 1.7 million healthcare workers and maybe the 10 or 11 million seniors, your death rates will go down by more than 9%.
So in the near term, what will it take to be able to find these infected kababayans? Do we have to ramp up testing? Do we have to ramp up on tracing and treating?
Yeah, that's being done as we speak. In fact, now, especially for those who are identified to have the variants, they're going as far as third-generation contact tracing. And some of the increase in cases will also be because we're doing very, very aggressive contact tracing, and so you really will pick up more positives. So the most important thing to watch out for is whether our hospitals are doing okay or if they're getting overwhelmed. Because right now we're seeing a surge of cases in the emergency rooms, and the cases are going up. But there are still hospitals that can accept more patients. Of course, we'd rather not have any more patients, but the most important thing is really to keep the healthcare system viable and still able to take care of people who need the help, especially those with severe COVID.
Dr. Edsel, you mentioned about aggressive contact tracing. Will it help that we will have a unified contact tracing app in staysafe.ph in about 10 days?
Yeah, definitely that will help because it will make the contact tracers much more agile and quicker to detect. I know there are several contact tracing regimens that are being used in different places. But getting them all together in one database is really important, because then you can have a whole of government approach in figuring out how fast these contacts are rising and how many of them are positive, and planning forward in terms of more isolation facilities and healthcare facilities.
And your advice to our kababayans watching us right now as we continue to see a surge in the number of COVID-19 cases?
Yeah, I think that, again, it's been a year. We've learned a lot. We know what works. We have to stick to what we know works and continue to understand that this virus has continued to surprise us. It's still there. Even if there's more movement around, it just means we have to be doubly careful, because the more people are around, the more likely that you can get infected if we don't stick to our minimum health standards. And on top of that, these variants are a real threat, and they can go out of control if they take over. Right now, the portion of variants is still low, about 5%, but if it becomes the dominant virus, it's going to be problematic, because we know that it's more transmissible and perhaps more deadly, particularly the UK variant.
Thank you so much for your insights, infectious disease specialist, Dr. Edsel Salvaña.